In May of 2023, at just 32 years old, Olympic track star Tori Bowie unexpectedly died. Published reports say Bowie was 8 months pregnant when she and her baby were found dead in her Florida home. An autopsy released the following month revealed she died from complications of childbirth, including respiratory distress and eclampsia, a disorder related to high blood pressure in pregnancy. Bowie's death, the latest to highlight pregnancy complications that disproportionately impact Black women.
The Centers for Disease Control and Prevention says Black women are 3 times more likely to die from childbirth than white women in the United States. The CDC found multiple factors contribute to these disparities, including quality healthcare, structural racism, and implicit bias.
We go in depth with the doctors and healthcare advocates who are raising awareness and taking action to save mothers and babies.
My sister was an amazing soul.
For former Baton Rouge NAACP President Eugene Collins, the memories of his sister Jessica Collins Ruffin are bittersweet.
Every one of my birthdays, she would always bake me a cake, and she would put my fraternity letters on top of the cake, and you know how important that is to us.
In March of 2020, Collins' sister was starting a catering business when she became pregnant with her second child, a son she named Jace. Collins says everything was going well for Jessica until her last trimester, when she thought something was wrong and went to the hospital.
The emergency room actually sent her back home.
On her way back home, their mom, who Collins says had previously worked for a doctor, urged her daughter to go back to the ER.
Went back to the emergency room. They set her back in the waiting room, and she sat there and had a stroke.
Collins says Jessica and her baby boy died just days apart.
If they had just listened to her the first time and took her back, I believe fully that she's still sitting here.
80% of maternal deaths are preventable.
Preventable, yes, and we know that from data from the CDC.
Dr. Faith Fletcher is a public health researcher and bioethicist at Baylor College of Medicine. She says there's something unique about maternal mortality because it impacts Black women of all ages, incomes, and education levels.
Feeling like they're not heard in healthcare encounters, feeling that they aren't respected, and we believe and have some evidence that these factors certainly lead to negative or adverse health outcomes amongst Black women.
Maternal fetal medicine specialist Dr. Keisha Reddick echoes Dr. Fletcher, saying many Black women feel their concerns are brushed off by their doctor.
We have to take the complaints and the concerns of the patient seriously, and we have to address them. Even if we think that it is maybe a normal symptom that you may have, we need to explain to the patient, well, this may be normal. A different symptom might not be normal.
But a May of 2019 study by the National Institutes of Health found that normal for Black women is often discrimination and poor treatment by healthcare providers. Doctors and nurses were less likely to identify pain in the facial expressions of faces of Black patients than non-Black patients. Because they couldn't see it, the study says those healthcare providers were less likely to believe a Black patient was experiencing severe discomfort or acute pain. And Dr. Fletcher believes that fight to improve maternal care for Black women should start with training and regaining trust.
We have to think about becoming a more trustworthy system so that we can regain the confidence and the trust of especially patients of color and other minoritized patients.
And what are the solutions? How can we work to change things?
With this generation of students, they're actually in some ways mentoring up. Their experiences and awareness of social issues and police brutality and healthcare mistreatment has really helped, I would say, to enhance our intellectual medical community with the tools and raising things and challenging the current systems to really improve and transform.
As for Eugene Collins, he hopes the medical community will start taking more notice, so no other family will have to endure what he did.
They had done their job, man. I believe my sister and my nephew, they'll be here today.
The death of Eugene Collins' sister did lead to change in the state of Louisiana.
In May of 2023, Governor John Bel Edwards signed the Jessica Collins Ruffin Act. The new law opens the door for more women to turn to a midwife for their pregnancy needs by offering Medicaid reimbursements. This means more low-income families will have access to midwifery services.
And on Mother's Day 2023, Congresswomen Alma Adams, Lauren Underwood, and Senator Cory Booker reintroduced the Black Maternal Health Momnibus Act. It's made up of 13 bills that address critical improvements necessary to give Black women better health outcomes. Our in-depth report continues as we go one-on-one with Representative Underwood.
We know that our nation's maternal health crisis is getting worse.
Representative Lauren Underwood is a registered nurse and the co-founder and co-chair of the Black Maternal Health Caucus.
A time of eager anticipation of welcoming a new addition to the family is now being marked by grief and tragedy.
Representative Underwood, along with North Carolina Congressman Alma Adams and New Jersey Senator Cory Booker, recently reintroduced the Black Maternal Health Momnibus Act to address what they call a growing crisis in the United States. The Momnibus Act includes more than a dozen individual bills that would, among other things, provide funding to community-based organizations that are working to improve maternal health outcomes and promote equity, invest in digital tools to improve maternal health outcomes in underserved areas, and make critical investments in social determinants of health that influence maternal health outcomes like housing, transportation, and nutrition.
It's designed to address every clinical and non-clinical factor that's contributing not only to maternal death in this country, but the disparities that we see that are impacting Black moms the most.
Representative Underwood has been trying for years to pass the entire Momnibus package. Although portions, including one to protect mothers who are veterans, have been signed into law, much of the Momnibus is under negotiation. Representative Underwood remains optimistic there are pathways for the entire Momnibus Act to pass Congress.
These are challenges that we have to solve together. The idea of maternal death and maternal mortality, that's not a partisan issue, right? All of us want to make sure that our moms can survive what should be a joyous experience.
The Momnibus Act of 2023 does have the endorsement of more than 200 organizations, including the American College of Obstetricians and Gynecologists, the March of Dimes, and the American Heart Association.
All right, Tisha, this is an important topic, obviously. Individual states are pushing for their own forms of the Momnibus Act, like the Jessica Collins Ruffin Act in Louisiana, right?
And that's right. Some women may not want an OBGYN. Instead, they may want a midwife to support them during pregnancy. And the new law provides increased reimbursement rates through Medicaid, and hopefully more midwives will accept it. Advocates see this new law as a start, but they say there's a long way to go.
And on the flip side, Black patients are also seeking out obstetricians, but a recent report by the National Medical Association says only 5.7% of doctors are Black.
Yeah, both Dr. Fletcher and Representative Underwood mentioned the need for more Black doctors. Dr. Fletcher specifically talked about the need for more research to understand the medical and social complexities around maternal health inequities. She also talked about addressing this crisis with healthcare workers and health policymakers and advocating for transformation in the delivery of medical education. So really thinking about how doctors are taught in medical school and how that affects their patients in the long run.
So many lessons to be learned from this topic. And as we said, I mean, it's so important. Just look what happened in Baton Rouge to that family.
People's lives depend on it.
No doubt about that.